Welcome to this webinar about our online Master in Nutritional Epidemiology and Public Health. My name is Rosalie and I'm one of the study advisors involved in this online master. Today I will moderate this session, and together with Amanda and Anna we will give you an overview of our online master and try to answer all of your questions. So please put your questions in the chat and I will have a close look at it and ask Amanda or Anna, or maybe I myself will answer the questions. Amanda, could you introduce yourself, please?
Yes, of course. My name is Amanda Jager and I'm the Adjunct Program Director of this program. Next to that, I'm, just like Rosalie, also one of the study advisors for about 5 years now. And in that particular role, I've seen many students, I've met a couple of students, also before the start of the master, and also quite many during all the different stages of the master.
Thank you, Amanda. Anna, would you like to introduce yourself, please?
Yes, of course. I'm at the moment a graduate student for this master online, and at the moment I'm in my 3rd year and I'm writing my thesis. I will tell a little bit about it later on. My background was in food technology, and then afterwards I did a pre-master at the Wageningen University, and then I applied for the online master Nutritional Epidemiology and Public Health.
Thank you, Anna. In the next 45 minutes, we will tell you more about our online master program, and we will share information, practical information, and Anna will tell about her personal experience as a graduate student in this master. We have divided the program into 4 parts. We start with the content of the program. We continue with Anna with an example of her thesis. We talk more about the structure of the program, and we'll finish or end our webinar about mission criteria and some practicalities. So please feel free to post your questions in the chat and we will try to answer all of them live during this webinar. But before we start, we would like to ask you some questions just to get to know you better as an audience. So you can type your answers in the chat and I will have a look at it. So the questions we have for you is: where are you coming from, or where do you live at the moment? What are you currently up to? So are you still studying, or are you working? Are you looking for a study next to your job, for example? Would you like to combine both of that? And maybe the most important question is, what would you like to find out during this webinar? Is there particular questions you have that you would like to have answered during this webinar? While you're typing all of your questions, I would like to show it to you where our current students are coming from. So in this picture you see some countries colored in orange, and you see that we have students coming from Canada up to Australia, but also South America, like Brazil, Argentina, but also the African countries are represented mainly from South Africa, Kenya and Uganda, and also from Asia, of course, mainly from Bangladesh and Pakistan, Iran. Though I have to admit that the majority of our students are coming from Europe and mainly from the Netherlands, and we also see that some students have moved from their home country to the Netherlands and then started the online master here. So we think that this international setting makes our master very well appreciated and also unique. So let me see if I have some questions already. I don't have any questions yet in this overview. So we can continue for now to the next part. And I would like to ask Amanda to tell more about the content of the program.
Yes, like Rosalie said, we have quite a unique master program. And one of the unique features of the program is that it's designed in such a way that you can follow it on a part-time basis, and it's completely online on a virtual platform. So you never have to come to Wageningen for the master. You just log in on your laptop. Well, a course program of 2 years is what you start with, and you can follow that. And it will prepare you for a tailor-made thesis and internship afterwards. And later on the webinar, I will also show you more about the structure, how this is organized. Well, during these courses that you follow, you closely collaborate with tutors, with your lecturers, and also with your fellow students from all over the world, like Rosalie also mentioned. Within this master program, you will learn the methods how to investigate the links between health and nutrition, and how to come up with an intervention study or a policy to improve the health of the population. That is the goal of the master. Well, next to becoming able to interpret data, you will also learn how to select the state-of-the-art tools for your data analysis and how to come to these results later. And also Anna will show us later on some of her own results. What is also unique about our program is that it offers you the flexibility to decide when you want to study. So if you prefer to study in the evenings or you have most of the time in the weekends, that is an option, and our master allows you to do so. And later on I will explain more about this flexibility, but I believe it's one of the strengths of this program. And next to that, according to our students, also the personal guidance is one of the strengths of this master program. So while it's completely online, you are in close touch with your study advisors, for example, and also the lecturers. They know every student just personally. Well, our study is about nutritional epidemiology and public health, and I would like to illustrate on the next slide what you can expect from that master. And I will use the letters of the word DISH to explain more about that. So what DISH do you get when you choose our master program? Let's start with the H at the end. So the core of the program is all about the health of the population. So for example, the prevalence of diseases such as diabetes. And we investigate which people within the population develop a certain disorder and what dietary patterns could be associated with that. So we're looking for these explanations in order to prevent a certain disease. Well, for that reason, we also need to know how to measure a dietary pattern. So we need to look at the intake of nutrition and food. And that's harder than you might expect at first. So you will get the tools how to assess nutritional intake. Well, you can imagine that the intake of food and nutrition has a direct effect on the status of the body, and that's what the S stands for here in this word. So you need to have knowledge about the human physiology, nutritional physiology. So what happens with your body, for example, with the cardiovascular system, when you have a certain diet? Well, you can either influence the health of the population by adjusting the intake of nutrition and food, or you can also look at the determinants of health. And that is also quite a complicated issue, because what are the determinants of health? You can think of how active are you during the week? So what kind of job do you have? But also your social environment, your cultural environment. There's so many things associated with what we eat. Well, all these factors, they come together within this master program with the ultimate goal: what can we do to improve public health? And on the next slide, I will show you what topics will come back within the master program. And that's what you see here. So you see in all the blocks some of the topics that come back. And if we go to the middle, we see in dark blue epidemiology. So it's also the name of our master, but you get a good foundation in epidemiology. We have multiple courses within the program, and you start at the basic level, and at the end of the master you will be an expert in epidemiology. So you will get all these state-of-the-art tools to investigate an epidemiological study and how to draw conclusions from that. Next to that, we have courses on physiology, nutritional physiology. We have courses on statistics, because that is what you eventually need to be able to draw conclusions from your data set, but also courses in the direction of public health, randomized controlled trials. These are all courses that you can expect within the master.
Thank you, Amanda. I was looking at the questions, but I'll come to that in a second. Now you have addressed many of the courses, and I would like to ask Anna, which was your favorite course? Do you have one particular course which is really your favorite, or maybe you have some more?
Yeah, I have a few actually. I really like the statistics course and the analytical epidemiology courses.
Yeah.
So the course where you learn how to work with a statistical program, how to analyze the data, how to write your own data script, and how to get the results, how to interpret them.
So it's really like programming your data analysis, the preparation for the data analysis, isn't it?
And I never had it in my bachelor, so I was a little bit overwhelmed in the beginning, but no, I really enjoy it.
No, you really have hands on it.
Yeah.
Was it tough at the start, you mentioned?
Yeah, It was tough, I think, but it was doable. So I had no basic knowledge on statistics at all, and yeah, it was really doable.
You managed.
Yeah, I managed. Yeah.
Nice.
Well, I hope I'm not done yet, but I think I'll manage. Yeah.
The courses you managed at least. Yeah,
exactly.
thank you. Very nice. There are a few questions came in already, and most of them I would like to save for later in our webinar. I can address already that we have listeners from all over Europe. Some are from the Netherlands, some are Dutch but living somewhere else, and I have a Portuguese student who's studying or living in the UK. So I think we have a nice group of listeners, of viewers, and it represents also our batch of students. And there's one question which we can address already: the number of students every year. Amanda, can you tell a bit more about that? How many students we have approximately per year?
Yes, it's good to realize that this master is quite small. It's quite a selective group of people that join it, and approximately 20 to 25 students every year join this master.
Yeah.
So you will get to know everyone within the master eventually, isn't it, Anna?
Yeah, for sure. Yeah, yeah. We have a really close group of peers. It's really nice.
Yeah. Well, thank you, Amanda, for answering this. So Amanda gave a rough overview of the courses and topics which are really prominent within our master program. And now Anna will share her personal experience by telling about a master thesis. So this is really an example of what you could do as a master student once you start with your master thesis. And within your master thesis, you really have your large project on which you work on. So this is an example. It doesn't mean that once you start your master that you also have to continue in exactly the same field as Anna did, but it's really to illustrate what you could expect. So Anna, the floor is yours.
Yeah, well, as I already told you, I'm currently working on my thesis, and my project is on vitamin D status and its effect on colorectal cancer patients. And then I look specifically at all-cause mortality and recurrence, and to see how the vitamin D works in the body and if there's an interaction with genetic predisposition. I also looked at specific vitamin D-related genes. So yeah, that's what I looked at for my study. And then in the beginning, you set research questions. I specifically looked at vitamin D status because vitamin D can be made as well in the skin as you can ingest it via supplements or via food. So the first research question was, what is the association between vitamin D status and all-cause mortality and recurrence? Then I also looked at the genetic predisposition and these outcomes, and I looked if there was an interaction between the vitamin D status and the genetic predisposition. For now, I will just focus on the first research question because otherwise it will be too long and I think too complicated for this evening. Yeah, so I used data from a cohort study that was based in the Netherlands, and 2,130 people from the colon study were included in this, and all these patients had colorectal cancer, and they were followed up for over 10 years. Or until they died or got recurrence of cancer somewhere in the body. The exposure that I looked at was, well, vitamin D status and genetic data, and that was collected via blood samples. And then I had some questionnaires, and there they asked about other covariates such as BMI, age, gender, and other factors you can think of. The data was actually already gathered for me, so I just got the data in a big data sheet, and then I needed to do the analysis. So on the, I think it's the right side for you, I'm really bad at right and left. You see a part of the script that I wrote, so you learn how to write your data analysis script, how to make it, how to analyze it, and yeah, I used RStudio for this. On the next slide, you can see how a data sheet looks like. On the right or on the left side, you see the respondent number, so all the people are kept anonymously. And you see that there are a lot of variables for every person. So yeah, you can see age and BMI, and well, I had over 60 covariates. And then in the beginning, you start to read the literature and to think of what is important to your research and what is not. And in the end, I had about, I think, 20 variables in my data, well, base actually. Well, then after that you do the analysis, you get the results. So I hope you can see this. In bold, you see on the top the hazard ratios, and the bold means, well, actually I made it bold, but it means that it's a significant result. So the results that we found are not due to chance. So for mortality, this was 1.56, and this means that 56% of the people had a higher risk of dying when being vitamin D deficient compared to being insufficient. And for recurrence, this was 2.08. So this means there was a 108% higher risk of getting recurrence when being vitamin D deficient compared to being insufficient. Then you can also make a plot of it. And you can see the survival, so how many people survived. On the left side, you see 1 to 0, so that's 100% till, 0%. And you can clearly see that the people who are vitamin D deficient have a lower survival status. Oh yeah, sorry, then we can go to the discussion. I'm currently still writing my discussion, so I don't have a lot to tell you about this. But I can say that the effects that I found in vitamin D status and mortality is something that's previously found in research, so that's good. For recurrence, there was not a lot of research published yet, so I dove into the underlying mechanisms, and it is in line with evidence that vitamin D plays a role in the cancer metabolism. A limitation is that it's low generalizable because I only did analysis in Caucasian people, so you cannot extrapolate this to other ethnicities. And for the genetics, I can say that's a good starting point for future research. I found some effects, but the effects were small. The sample sizes were very small because I needed to exclude people from whom I didn't have the vitamin D status or genetic data. So in the end, there were very small sample sizes, and I could not really see a difference or big effects. And well, that brings me to the conclusion that I have at this point, and that is that high vitamin D status are associated with lower all-cause mortality and recurrence, and that genetic predisposition might play a role in this association.
Very nice overview, Anna. Thank you. So you're actually ready with your thesis. You have presented it like this. Thank you. I have two questions related to your thesis.
Oh, yes.
One about the thesis itself. You already mentioned that you cannot generalize it to the whole population or whatever. But what implications could it have for the colorectal patients?
Well, for the Caucasian colorectal cancer patients, at this moment, you could maybe say that for stage 1 to 3 cancer patients, in case of mortality, it might be beneficial. For recurrence, I'm the only one who found a big effect, or at least in literature, I cannot find anything about it. So it's a little bit
maybe
cocky.
You're the first one to
but it's a little bit cocky to say like I found the result and this is it. So there needs to be done more research. So as for now, you cannot really say much about it, also because stage 4 and 5 cancer patients have a different association. They get worse effects when they have a high vitamin D status. So it's still a difficult topic.
And a very practical question, which also came from one of the viewers. You mentioned that you use a statistical program R. And would you also be allowed to use different statistical packages like SPSS or SAS?
Or at least I know some peers of mine, they are using SPSS or SAS data even, I think. I chose R because in the first 2 years you just learn how to work with R. And there's only one course that mentions a little bit other statistical programs. But no, we only worked with R, so...
You're used to R.
So I'm used to R. I already got the script from the courses, so you know how to write it, how to interpret it. So, but you can if you want. Of course.
If you would have wanted, or if you would have known SPSS already better.
And I think some programs are better for different types of analysis. True. So I think that's something that's always.
Thank you. That answers the question. There are some more questions, but still I will save them for later moments. And then Amanda will tell us more about the unique features of our program.
Yes, so let's move to the structure of the program and the features of the program. So our master is an internationally accredited program, which means that after completion of the master, you earn a full master degree, which is equivalent to if you would have a master here on campus, which is full-time. So the master degree that you eventually get is equal and fully recognized. One important aspect, and we have already mentioned it quite sometimes, is that you don't need to come to Wageningen every day. You visit Wageningen, but then virtually. So you do this via virtual classrooms, through discussion fora, individual assignments, but also group assignments that you do within a course. Another aspect of the online master is that it's organized in such a way that you can follow it on a part-time basis. So if you join the master, we expect that you spend about 21 to 24 hours a week studying for this master. And it's up to you when you want to study. So like I said in the beginning, if you feel like studying more in the evening or in the weekend, that's all fine. And we need this flexibility because we have people within the master that come from all over the world, from different time zones. And we have adjusted all the courses in such a way that you can work together, also with people that are living at the other side of the world. Now, many people within the master, they have either a part-time job next to it, or a family to take care of, or another master degree that they're following at the moment. So we have many combinations, and well, I personally believe that also makes that the group is very diverse, people with different backgrounds, different cultures, and that makes it a very nice and interactive group. Well, on the next slide, I will also show you an overview of what the two first years look like. So in the first 2 years, all the courses are scheduled, and this is just to get a feeling of what the program looks like. So here is the schedule for the next years. So this was from September onwards. You see that before the start of the program, we always have an onboarding week. And this is a week that we come together, online of course, and we get to know each other. We do virtual games with each other to get to know your fellow students. And we tell you everything that you need to know before the start of the master. So that's the week before we start. And in blue, you see all the regular courses that we give. So in total, over the 2 years, on a part-time basis, of course, we offer 16 courses, and these courses nicely build up on each other. So the knowledge in the first courses will be used for the next courses. And like we mentioned before, for the epidemiology courses, we always start with basic courses, then we go to intermediate advanced levels, and eventually we go to advanced levels. So it's organized in such a way that the order is very logically, and well, all the content that I showed you in the beginning, it will come back within these 16 courses. But we also have courses in these 16 courses that combine all the knowledge that you got in the courses before. Besides that, you also see courses in green, and these are special courses. So we have 2 projects to work on, group project works, and those are both scheduled in the second year. One is about grant writing, and the other one is about the development of food-based sustainable guidelines. Did I say that correctly? Sustainable food-based
dietary guidelines.
But
that's okay.
Yeah, it's a very long title.
Yeah.
Besides that, we also have 6 academic skills that we will train you on, like presentation skills, information literacy, argumentation skills, and those are scattered throughout the 2 different years. Yeah. Well, if you have passed the exam, well, that's always good news. But if you have failed an exam, there is also an option to retake the exam, and that is what you see in orange. So at the moment, there are 2 possibilities per year to retake the exam. If you don't have to retake the exam, you have additional holiday. Yeah. That is indicated in, well, in gray. If you want to know more specifically about the different courses that you see here, please go to our website, to the study handbook, and you can find a description of what to expect within these courses there.
Thank you, Amanda. The link should be viewable in your webinar, so you can click on it, and meanwhile also continue watching us, of course. But then you can have a look at courses and closer description, or more described what a course contains. I have a couple of questions for you, for both of you. Amanda, you mentioned here you give the overview of 2 years courses, but at the start we already mentioned that our master is 4 years. So what does that entail? Can you also shorten your master up to 2 years, or just a small answer to that?
That's a very good question. So like I said, the courses that you see here, they build up on each other. So when you enter our master program, you cannot shorten what you see here. So you cannot combine the first and the second year courses, but you need to go through all the courses in this order. After these first 2 years, and I will show it at the next slide in a while, in a bit, then you have your thesis and your internship. And after completion of that, it will take you 3 to 4 years to complete the whole master's.
Yeah.
So this is not it, no.
So that would imply that if you continue on a part-time basis, then it would take you up to 4 years to complete your master. And if you somehow switch to a more full-time study, then you can shorten your studies up to 3 years. At least 3 years it should take you. And yeah, maybe you can address that on how are the courses organized? And there are many answers to that, but one of the questions I have related to this is, would a new student need to come to the university or sit ready at 9 o'clock on Monday morning, or how should I visualize that?
Well, I actually missed the onboarding, so I think you will get how you need to enter the system and everything. But you come to Brightspace, it's like an online thing where you can go to, looks like Blackboard, I think most people do know that. And you see the course that you're going to follow the next coming 4 weeks, and you click on it, and then you have nicely week 1, week 2, week 3, week 4, because all the courses are 4 weeks. And then you just have all the information in there. So you can do everything on Monday morning at 9 o'clock, of course, if you want. But you can also just spread it out over the week. And you can take it actually whenever you want. Sometimes there are assignments that you need to hand in, but it's always at the end of the week. It's never that they say you need to hand it in.
We know that we call it a knowledge clip, but what does a knowledge clip mean? Is it a lecture of 90 minutes, boring, falling asleep?
I think there's only one course that has real lectures in it.
Yes.
Yeah, and it was really like, do we have to watch it for 90 minutes now? But every other course, all the 15 courses have just short clips and then short readings. And actually, I enjoyed it much more than just sitting for 90 minutes staring at the screen, because you don't interact. You're not interacting with the lecturer, so it's much easier to watch the short clips, and then you make an assignment, or we have e-modules, so it's like learning and playing a little bit around. So then you see the graphs moving and everything, and it's a nice way of learning.
So the knowledge clips are already recorded beforehand, and then you watch them, and you can watch them multiple times. You can slow it, put it also faster. And you already mentioned that you have a lot of contact with other students, but how do you do that?
We have the discussion platform at Brightspace, but we just made a WhatsApp group. So at the beginning of the year, we made a WhatsApp group, and everybody wanted to be in there. And I think everybody was in it in the beginning. We were just talking with each other. So, do you understand this? Or how hard do you do this? Or what's the assignment? Or should we meet up tonight and help each other out? So, and even now during the thesis, we're not all at the same pace, but still I am in contact with a lot of my peers.
Oh, and an important question is, how does the exam take place? Because you do it online, so how does that work?
Well, you sit at a desk at home, and you need to clear it out. And then you take your laptop or anything else that monitors you. And then you make a room scan. So you scan your table and the ceiling and the floor and everything to make sure that you don't have any notes or anything, so you cannot cheat. You really cannot cheat. They're very strict. You cannot. And then you take the exam at home, and you can take it almost all day. So for the Netherlands, I think it's from 8 o'clock in the morning till 10 at night or something.
Dutch times, of course.
Dutch time. So it's a really big time frame. Yeah, it is. Yeah. And there's even help. So if you're stuck and you cannot click through, or there's a problem with your Wi-Fi and it's fast out, you can just call the service line, or you can chat with the service line. They will help you. So. It's actually more relaxed because you're at home and you can just have your coffee or your tea and then make it, and then you're at home. You're not
nice to hear
in a room with all the students.
Because I can imagine you're being watched. Everything is recorded, and there's some organization who checks whether you indeed didn't cheat or did something weird. So it's remote proctored, but you do it at home or wherever you are in a quiet, calm room. You have your exam. And Oh, I see that the link is not working, so we'll work on that. Meanwhile, then you will see the link later on again. Let's move on to the next part. Amanda already mentioned it shortly, but about the thesis and the internship, because that's a major part of your program, of course.
Yes, let's continue with that. But before that, I would like to add to what just Anna said about the exam. So the exam is always on a fixed day.
Oh, yeah,
So you cannot do it, for example, in the weekend, whenever it fits you. But usually it's on Thursday in week 4. So as you see, or you saw in the schedule that I just showed to you, every regular course takes 4 weeks. And so sometimes you have deadlines throughout the different weeks. And then in week 4, usually there are no deadlines for assignments. But then on the Thursday, you can log in between 8 in the morning, 10 in the evening. And then you have a time slot in which you need to finish the exam. So you cannot log out in between, go away, and then come back and continue with your exam. Once you start it, you need to finish it. So that is just to clarify that a little bit more.
Yeah.
Well, let's go then to the thesis and the internship as promised. So after taking these courses, you will put all this knowledge and your skills into practice during the master thesis and subsequently your master internship. And well, we just got a question, how long will it take me to finish the thesis and the internship? So here I've also put how long it would take you on a full-time basis. So since this is an individual assignment, so you're going to investigate your own research question, you can decide by yourself whether you want to continue on a part-time basis, or if you want to switch to full-time or something in between. And then, it's up to you and your supervisor to make agreements on that. So usually what it would look like if you do an online master thesis is that you will get a data set that you're going to work on. But if you live closely to the Netherlands, sometimes it's also possible to come to Wageningen to do your thesis. So there are many options there. But one of the most important things to realize is that the thesis is a research project that you do on the supervision of a WUR supervisor. So that will enable you to get good knowledge from one of our scientists before you go outside for the internship. So that is the biggest difference, because when you go for your internship, you can go to any research institute or health institute, university that you want. Can be in the Netherlands, can be abroad. And then you can do your research there. And that will be for 4 months on a full-time basis. So also if you do that part-time, it will take you 8 months. So there are many options there. And we will also guide you in finding a thesis or an internship. So in the second year, I think we will get back to that later, but there's also a special week. And then Rosalie and I, we will also discuss with you what kind of thesis you want to do. What are your plans for your internship? And we will try to match you with some of the researchers. So you will get supervision and guidance for this part.
Yes. Thank you, Amanda. Well, Anna, you're already working on your thesis, so your next phase will be your internship. Do you already have an idea what you would like to do during your internship?
Yes, I will go a little bit in the same route as that I'm already taking. I will look into the vitamin D receptor, genetic variation within the receptor, and then on depressive outcomes within elderly. I will do that in Amsterdam in the Netherlands.
Actually, there was a question about vitamin D, and the person mentioned that vitamin D intake is not really an issue. I'm not sure whether she referred to the Netherlands, but how do you see that?
If intake is not an...
Vitamin D intake or status, is it an issue in the Netherlands?
I think during the winter especially, but I think most people, when being healthy overall, will not have like a negative effects of it. But it might be that if your status is always a little bit low, that maybe later in life, 30 years later, your risk will be higher. We don't know it yet. It's
it will be definitely a possibility if you're interested in a certain nutrient.
Yeah, for
that
sure.
You study the association between a certain nutrient.
And it also differs between subgroups and everything. It's because guidelines are for the general population. So it's very interesting that you learn how to we'll focus on the subgroup. And yeah.
Thank you. Thank you, Anna. I have one more question, Amanda, maybe you can address that once more. It's our online master, same as our on-campus master, is 120 ECTS. So for each course what you take in the first 2 years, you can earn 3 credits. And so those 2 years add up to 60 credits in total, ECTS. And then your thesis, your master thesis is 36 ECTS and your internship is 24 ECTS. So that makes it 120 ECTS. So that's the same for more or less all masters in the Netherlands. Yes, I think we can go to our overview of the program.
Yeah, you already gave us a good overview of the number of credits. Thank you for that, Rosalie. And let me repeat it in different words. Again, so a master program consists out of 2 years of part-time courses in which you earn 60 credits. After that, you can continue with the master thesis, which is 6 months on a full-time basis, and also worth 36 credits, and then the internship of 4 months, so 24 credits on a full-time basis. So the total duration of the master program is at least 3 years, and most of the students, they take like between 3 and 4 years to finish the master program. On the right side, you see all the different topics that come back within the courses with the nice word of dish there.
Yeah, and well, we've been stressing all the time that it's about 3 to 4 years, but what if you need a break in between, either due to family circumstance or because you're busy with work? Is that possible? Can you take a break in between?
It's a very good question. And as you can imagine, people within our master program, they have very diverse backgrounds. They have a lot of of balls to keep in the air.
Yeah.
Many responsibilities, tasks. They have most of the time have family next to it, and maybe another job, maybe another program that they also attending. And if you need to take a break, that is always possible. And you can always have a chat with me or with Rosalie. And I think in all cases we find a solution for that. Yeah. Especially if we look back over the last years, there were many students that were struggling, that had difficulties due to the corona crisis, also work issues. Some had to work more shifts, for example, if they were working in the health sector. And we figured out a solution for that, yes. Yeah.
True, we can always make a tailor-made program or some solution for that. We've noticed that some of you missed the link to our course guide, so you can find it yourself on the website if you type courses.wur.nl, so courses.wur, WUR stands for Wageningen University Research.nl, so you can always have a look at that. And there's also a question whether you can follow only a few courses and not the whole master program. Well, you can have a look on our website or the website from the university and see what are the possibilities there. In my opinion, I think if you would do the other things, so that you only follow a few courses, that might become pretty expensive. So I would advise to either check with Amanda and me what are the possibilities here, whether you would enroll as a master student and then decide to follow a few courses. But we can see what are the options here. And we'll come back to that one in the very end, but just to answer your question already, it's about tuition fee. On the website from the university, you can find the tuition fee specific for your personal situation. So if you are from the Netherlands or within one of the European countries, so unfortunately not the UK, then the tuition fee would be around 2,500 euros per year. And if you will be a non-European student, then the tuition fee is a bit higher. So do have a look at what are the costs for your studies. Within the Netherlands, if you have already completed a master in the Netherlands and would like to start a new master, then the figures for the tuition fee is also different. So really have a good look at it. If you're not able to find it, then please do contact us so we can help you with that and refer you to the right people to have a good answer to that. Let's go to our one of our last slides. It's about admission criteria requirements. Oh, sorry, no, it isn't. I'm a bit lost now.
Let me help you.
Oh yeah,
Rosalie.
there's another question here, because Amanda, you already mentioned that you do come to Wageningen that in the second year. So we have of course we prepared for that. We have a slide about the so-called Verweek. And that is the one exemption within this online master. Everything you do from home or wherever you are, but you can do online. But there's 1 week in your second year that you come to the Netherlands, to Wageningen. And here's an impression of our last week, a couple of years ago when we had it on campus. So all the second year students come to Wageningen, and yeah, it's really an exciting week, because then finally everybody meets each other in real life, in person, and you also meet with your teachers who you've been viewing online, of course. You can already start thinking about what kind of thesis you would like to do in your third year. So you can already meet with your potential supervisors, your thesis supervisor, and above all, you also work on a large project. And the first project would be the grant proposal writing, so that you would be like a researcher and going to write a proposal for a new research. So we also show you around on the campus. Here you see some pictures. These are the left side, you see the educational building from the university, but we also visit Unilever, a big food nutrition company in Wageningen. And yeah, I think it's really exciting. And well, Anna, you attended it online, of course, but we do hope that in the coming years we keep doing this on campus. Now we move on to the admission requirements. Amanda.
Yes, let's move there, because you're all probably waiting for this point. So the admission criteria. Well, you can be admitted to the program if you have a bachelor in one of the areas that is related to the field. And here you see a list of bachelor degrees that are related. So you can think of nutrition sciences, biomedical sciences, or medicine. Nutrition and dietetics is also a good bachelor background. And if you have another bachelor degree and you're not sure if it's really related, I would say always just send us an email, send your transcript of records, and then we can check whether you're eligible for the master program. And also Anna did a bachelor degree that is not in this list, so you can always give it a try. You need an average mark of at least a 7, which is equivalent to a GPA of 70% or higher. And you also need to prove that you're proficient in English. So if you want to see more details on how to prove your proficiency, please visit our website, and we have described exactly what kind of tests you can use to prove this proficiency. Well, if you have decided that you want to register and be admitted to the program, you can go to StudyLink, so it's a Dutch website, and there you can apply for admission to the program. Please do also already apply via StudyLink if you're not finished with your bachelor yet, but you're planning to be done before the 1st of September. You can send in all the latest forms, your transcript of records when you're graduated, but you need to apply before the 15th of June 2023. So please don't miss that deadline. And like I said, if you're in doubt, or if you want to have a meeting with me or with Rosalie, that's always one of the possibilities. And at one of the last slides, we will also show our contact details. Just send us an email and we will get in touch with you.
Thank you, Amanda. So really to stress once more, even if you haven't completed your bachelor yet, but if you manage to complete your bachelor before the end of August or before the 1st of September, do apply for our master, and then you can start in September. If you graduate in September or later than that, then it will be 1 year later also, so September 2024. Yeah, I have one question related to this. It's about scholarships. There will be a link presented in the webinar as well, where you can find more information about scholarships. So do have a look at that. I think we'll come in the last slide, we also addressed that, but what kind of diploma would you get? It's the same diploma, in fact, as for our on-campus master. So would it also mention that you did an online master? It mentions the title of our master, isn't it, Amanda?
It's a very good question. Our master program is a variant, so this online master program is a variant of the on-campus master program, Nutrition and Health. So if I'm correct on your diploma, I haven't seen an online diploma yet, but I expected there would be Master Nutrition and Health, and then that you have the online variant.
Yeah, so it wouldn't mention words like e-modules or e-learning, something like that. No, thank you. Then we are coming almost to the end of this webinar. So I'd like to summarize what we've been telling you in this session. So please ask any remaining questions you have. A few I will address after this slide. And we have been informing you about the typical courses in our master, which you see on the left side, upper corner. And the courses are structured around our DISH model or DISH menu, like the DISH stands for determinants, intake, status, and health. And so once you know how to assess the epidemiological association between determinants, intake, status, and health, then we can be able to play a positive influence or to really have an effect on public health. So the emphasis in our master is about teaching you how to apply epidemiology, how to do epidemiology, and also how to think about how we can intervene and improve the public health. So it's not only about the theoretical part, but also to get really hands-on, like Anna told us already, how to perform your epidemiological data analysis, and also how to construct a public health intervention program. So as stressed before, but our online master is really an accredited program. So you get the same diploma as if you would come in person to Wageningen University. But really a difference with our on-campus master is that it is flexible, it's on a part-time schedule, so it gives you some flexibility, though we keep on stressing it. It's also good to keep in mind that especially in the first 2 years, you will follow courses every 4 weeks, which we conclude with an exam at the end of the 4th week. And after completing all those courses in the first 2 years, or maybe a little bit longer because of some circumstances, then you move to the second part of our master and you continue with your master thesis, and finally you complete your master with your internship. I have a few more things I would like to address. We have been having viewers who did or are doing health sciences, who did a study in medicine. So what I've been seeing, so I can assure you already or reassure you that with your professional or educational background, you seem to be admitted, or possible that you will be admitted to our online master. So don't hesitate about that. And if you do hesitate, then please send us an email, which I'll show you in the next slide, our contact details. Here it is. Yeah, I think that was the main things. Let me check. Yes, a few more questions have been coming in. One of that is about the future job after the master. That's an interesting one to still give you some examples. Can I invite one of you, or do you want me to address it? What kind of job, or maybe Anna, do you already have something in mind what you would like to do?
Well, I have something in mind. I am at the moment trying to find a PhD position somewhere. Yeah. So
in epidemiology.
In epidemiology, yeah. So I'm looking all over Europe, and I'm also looking at jobs. But I really want to focus on epidemiology, doing data analysis, researching more, and I know a few of my peers are also going to that route.
Nice.
And, yeah,
nice to hear. So we train you to become an epidemiologist and also to use or to know how to influence public health. So you become a public health nutritionist. We also mainly train you to become a researcher. Of course, you don't need to continue in research, but Anna would like to, of course. But you have the tools and also the academic way of thinking, so you could continue also in a company or an organization in the field of epidemiology and public health, or maybe you switch a bit more to the nutritional field. Would you like to add something to that, Amanda?
I think you described it quite clearly. What we also sometimes see is that if people join a master and they already have a job, that this master helps them to get a promotion within the company that they're currently working. So that might also be an option. And what I forgot to mention, I'm now thinking about that, is that also in some cases it is possible to do the internship at the place you're working at the moment.
Yeah.
So that is for some people that already work at an academic level a very good option also to speed up with the master program. And it will also give you like opportunities to get a promotion afterwards.
Yeah, true. Yeah, that's true. Well, I'm going to almost conclude with this webinar. A few things I would like to answer because of the questions we got here is the GPA is important, so you need to have a sufficient or a good grade, average grade when you apply for this master. Though if you think that your GPA is a bit lower than what it should be, but you have relevant work experience, then definitely do mention your work experience. You can always attach more documents or include it in your CV. What is your work experience? So that might cover it if you have a bit lower GPA. And let me think. Oh yeah, and once more about the tuition fee, but you can definitely find all the information also on the website. But if you would be a Dutch or European student and you would take exactly 4 years on your studies, then the cost of your study will be 4 times the tuition fee you pay, and the tuition fee, well, if it doesn't increase in the coming 4 years, it will be 4 times €2,500. So then that's about what you can expect, of course. So I think we have addressed all the questions. So I'm going to say goodbye to you. I would like to thank you for all your attention. If you have questions, do check it on the website. You can also send us an email. The email address is mentioned on the left corner below. So we can always be in touch. If where possible, we can also have a meeting, online meeting, of course, with me or with Amanda. And yeah, with this, I would like to thank Anna for coming here. It's the first time for you in Wageningen.
No, it's not. No.
Not the first time. No,
I did my bachelor's.
Yes,
my
of
first
course.
year, so yeah.
Yeah,
no.
but in the last couple of years,
the last 8 years I've been somewhere else. Yeah. So it's a long drive again. Yeah. But happy to be here.
Yeah. Thank you, Amanda, for your complete picture of our study. And well, thank you once more. And I wish you, well, maybe it's very early for you in the morning, so I'd like to wish you a nice day or a very nice evening. And see you maybe in the next years, in a couple of months. Thank you. Bye.
Bye.